First up was a clinic in Tempe, Arizona that I had heard had a 90% success rate treating cancer naturally, even with the FDA restrictions. So I hopped on a plane to find out if this was really possible.
What it's very important for us to do, and the reason that we're having more success than the chemotherapy oncologists, is we're not giving cancer an opportunity to detour. We're not giving it an opportunity to escape down one of its usual pathways, but we're surrounding it on all sides, all the ways, the multifaceted ways in which it attacks the body. We're addressing all those simultaneously. So cancer has nowhere to run. You know, it has nowhere to mutate to. Whereas with chemotherapy, what generally happens is chemo is thrown at cancer for a little bit until the cancer learns how to be stronger and how to resist that chemo. And then, okay, another chemo drug is thrown at it, but the cancer just gets stronger after that. And that's a problem because the rate of recurrence is very, very high with chemotherapy patients. Whereas with metabolic therapy patients, the recurrence rate is very low. And I think that's what's ultimately most important to cancer patients. 5 years from now, they don't want their cancer. They don't want to have to still be dealing with this.
Colleen Huber and those like her think about the individual and the entire ecosystem of that individual's being, both physically and their history. She has a purpose, she knows exactly what she needs to do, and she knows exactly what you need to do. And you follow her regimen. These other doctors, here's the template. Stick you in it. She's just the opposite.
There's a place in Tempe, Arizona called Nature Works Best, and they have a documented 90% success rate treating cancers with infusions of vitamins, minerals, and amino acids. And they...
So let me jump right in.
Yeah.
So 90% response rate.
Success.
Or success rate. So for us to claim that, and when I say us, take traditional medicine, we have criteria that we have to meet. We have a patient with cancer, maybe they have imaging studies where we can see the cancer and we can measure it. No data's been presented to that in a peer-reviewed, respectable journal.
In fact, Dr. Colleen Huber has published her results at numerous conferences, but no one in the traditional medical community seemed to be paying any attention. In it, she presents the results of 379 patients with all different cancers receiving treatments of multiple natural agents. The results for stages 1 through early stage 4 are 93% in remission.
Stage 1 through 4 have done much better with natural treatments than what we see of conventional treatments. In fact, the people who have decided to or been convinced to leave here, leave the natural treatments in order to do the conventional treatments, pretty much reliably, predictably die within a short time. And once others begin to see that, they say, wait a minute, it wasn't the cancer that killed him, it was the chemotherapy. And they begin to observe and they see, that's what's going on.
So they said, please just talk to this doctor, this naturopath in Arizona. You can just do a consult over the phone. It was, I don't know whether it was $150 or $300. She'll talk to you an hour and just, what could it hurt? You know, you have to wait to have the surgery anyway. They're not going to start the radiation till after your surgery. Just talk to her. So I talked to Dr. Huber at Nature Works Best and for an hour, and I was just so impressed.
And before we got done that hour, she was telling us stuff about my wife that we should have heard, and more importantly, never heard from anybody. They don't even ask the questions. She had ER/PR positive breast cancer. Not one of those doctors ever tested her estrogen levels. Not once. Because that's not the standard of care. Cut it out, burn them, give them pills, poison them, because that's what it is. Yeah, I know that's brash and hard to hear, but it's the truth. Well, Dr. Huber found out that with one blood test, that her estrogen levels were north of 800, when a woman her age should have been in the 150s. And post-menopause would have been in the 50, 60 range. That's why she got cancer, right? But do you think anyone else even asked the question, did the test? Nah.
You know, a caveman looks at cancer and goes, oh, cancer bad, need to remove everything with cancer. And then scorch everything else so cancer never come back. But a doctor says, that's interesting, there's cancer growing in there. I wonder why. What is out of balance in the body that we need to bring back into balance? And once it's back in balance, the cancer will have no room to grow, and it's possible to do the testing to find out why cancer's growing, what the body needs, and how to starve the cancer.
Instead of going to look for a prescription for something that your body has no congenital need for, but we do know that we have a congenital need for nutrients and good food, and then it kind of makes sense to look for a solution first in your food. As Hippocrates advised, look to food for your medicine and let your medicine be your food. It makes sense to start with things that we need before things that we don't need, like pharmaceuticals generally.
So I met with Dr. Huber every time I came in. She would collect my information of how I was feeling and how I was doing. And so the IV is made up just for me, for what I need to heal the body.
She suggested different types of supplements, such as turmeric and artemisia and dandelion root, things that would combat the cancer in my bloodstream as well as in my body. And I was to make a juice shake every day, and she taught me exactly what types of fruits and vegetables would fight my cancer.
I felt like the treatments, which were IVs 3 times a week, all natural things to build up my strength. And I did that for 3 months.
She also insisted that I eliminate all forms of sugar from my diet.
Mostly at this clinic, we use intravenous nutrient treatments that are specifically targeted to people's cancers. Our strategy is to work with the metabolism of the body. And that is, if you work with the normal metabolic processes of the body, you are going to be able to defeat cancer more easily. Why? Nobel Prize winner Albert Warburg showed us in the 1930s that cancer is basically a machine. It exists, as Stephanie Seneff, PhD, pointed out, it exists for the purpose, perhaps, of converting excess of glucose that the body cannot tolerate to lactic acid. It's a machine that does that function. It does it inefficiently, and unfortunately, that machine really interferes with the machinery of the rest of the body. So that is a process that is kind of a detour from normal metabolism. What we do is we facilitate, we enable, we drive the normal metabolic processes of the body. The processes that are described in biochemistry, the processes that most of our cells, our normal cells, undergo. And so when we push those normal cell pathways, then we kind of deprive the cancer machinery. We make it irrelevant. We divert body resources away from it. It seems to be something that the body tolerates well. So when we use that strategy, there's no downside.
My side effects where I feel wonderful, my aches and pains have gone away, my skin gets better, the acid indigestion that I'd had for several years was gone, you start to name it, and it's just like there was just no side effects at all.
And then, continued with her treatments, and I never felt so good in all my life.
What I especially wanted was for cancer patients to be able to have an alternative to treatments that are very toxic. And I wanted it to be affordable to them. I wanted it to be an alternative. If I have cancer, I do not want toxic treatments myself. I absolutely know that for a fact, and I especially know it after 10 years of working with cancer patients, seeing all kinds of cancers come through here, and there is no type of cancer for which I would choose toxic treatments for myself. Especially knowing that there are things that you can do to eliminate cancers without that. While you maintain the well-being of the body, while you just maintain the person's strength and work to enhance that.